Hello, everyone. Thank you for joining us. We are just about ready to get started. Dr. Zhu and Dr. Gutzeit, if you could turn your cameras on. There you are. Excellent. So Dr. Zhu and Dr. Gutzeit will read a brief statement each, and then we'll open up the questions. Everyone in the meeting right now is muted and their camera is off. When you have a question, please raise your hand. I will call on you one at a time, turn your camera on, or at that point, you'll be able to turn your camera on if you want, and I will unmute you. You can ask your question, then I will mute you and turn your camera off at that point. So now I will go away and I will open it up to Dr. Michael Gutzeit, our Chief Medical Officer at Children's Wisconsin.
Good morning, everyone, and thank you for the opportunity to share information about a new syndrome in children, which is associated with COVID-19. This syndrome has been reported in other states and other countries, and Children's Wisconsin has identified the first suspected cases of multi-system inflammatory syndrome in children, known as MIS-C in the state, and we reported under the Wisconsin Department of Health Services. In total, there have been 7 cases going back to April of 2020, which are being reviewed. Of the 7 under consideration, 5 were discharged after relatively brief hospital stays at Children's Wisconsin. 2 children remain hospitalized and are in good condition. 2 of the cases tested positive for COVID-19 antibodies, a test that's used, and 2 tested negative. 2 are pending results, and 1 child has not been tested. The symptoms are similar to Kawasaki disease, which is a known but also very rare disease. As multi-system inflammatory syndrome in children is still very new, and there is so much to learn, we're taking a conservative approach with the state and reporting all possible cases in order to gather as much information as possible. And this will ultimately help us and other healthcare experts determine the risk factors and clinical course of the syndrome and the connection it has to COVID-19. Kids with this syndrome present with a range of symptoms, including persistent fevers, abdominal pain, rash, redness in the eyes, trouble breathing, abdominal pain that is related to vomiting, diarrhea, changes in behavior, lethargy, and just overall a generally very ill appearance. They show signs of inflammation on blood tests that are done and evidence of non-function in 1 or more of their organ systems, including the heart, the lungs, kidneys, gastrointestinal tract, the GI tract, the brain, and blood vessels. Additionally, some kids have evidence of a current or recent COVID-19 infection or exposure. While we understand that this is a newly identified syndrome and the symptoms can be severe, it's important to remember that the vast majority of kids recover with brief hospital stays. In some cases, no hospitalization is required. We are actively trying to learn more about risk factors, clinical course, and the treatments for this syndrome. And reporting suspected cases in collaboration with the Wisconsin Department of Health Services and similar processes in other states is a very important step to learning more. Another important step that Children's Wisconsin has taken to help identify and treat kids with this suspected syndrome is to create a multidisciplinary team to develop a care plan for any child who comes to the hospital with these symptoms. This team was formed when these cases started to be reported globally in the United States in late April and May. And it's important to remember perspective here. COVID-19 was first reported about 6 months ago. So while we know a lot about COVID-19, we still have a lot more to learn. And in a very similar way, this syndrome is something even newer and more recently recognized. So there is still quite a bit to learn about it as we produce information and share information. At this point, I'm going to turn over to Dr. Frank Zhu, who is our Medical Director for Infection Control and Prevention at Children's Wisconsin, and is part of the team that is investigating this and looking into the cases. Dr. Zhu?
All right, thanks, Dr. Gutzeit. So, as a leading pediatric institution, we're always committed to learning and staying on the forefront of diseases that affect kids. And to that end, our experts have been reviewing the literature and collaborating with our partners both overseas and in the United States on developing a clinical care pathway so that we have a sort of uniform approach for treating and diagnosing kids with the syndrome. So this current working group includes physicians from critical care, infectious diseases, hospital medicine, immunology, emergency medicine, rheumatology, hematology, cardiology, and primary care to make sure that we are we are approaching this from a multidisciplinary standpoint because it does affect many systems in the body. And while we are always learning more, our experience and that of communities around the world is that MISC is still extremely rare in children. And while it can be serious, most do recover with medical care. It's a difficult disease to diagnose because while the initial presentation can be similar to Kawasaki disease, it is still a distinct entity and different from Kawasaki disease, and seems to be, and this syndrome is associated with COVID-19, whereas Kawasaki disease is not, and we've known about Kawasaki disease for many decades. Due to the newness of this, as Dr. Gutzeit said, the diagnostic criteria or case criteria, if you look at the CDC sites, are generally quite broad in the sense that we don't want to miss any new cases, and we want to collect as much data as possible about possible cases to learn more about the disease. So right now, what we would recommend is that parents should call their pediatrician if their child is experiencing any symptoms that may be consistent with MISC, which include persistent high fever and other symptoms such as abdominal pain, rash, red eyes, difficulty breathing, nausea, vomiting, changes in behavior, lethargy, or just generally appearing ill. While we do acknowledge that social distancing is important, we encourage our parents not to avoid seeking medical care, especially if you're concerned about either COVID-19 or any other complications of COVID-19, such as MISC. We do take special precautions at all our locations to ensure your safety, including requiring everyone to wear masks, as you can see, and screening our employees as they come in every day for illness. Parents who have any other questions or concerns should contact their child's pediatrician, and they can also talk to a pediatric care provider through our online urgent care video visits.
Thank you so much. We'll open it up to questions now. Please raise your hand if you have a question. I will unmute you, and at that point, you'll be able to turn your video on if you like. Oh. Let's start with Kent Wainscott. Kent, do you want to go ahead?
Yeah, thank you very much. I guess my first question involves the transmission. Is it similar to COVID? How is this spread and how contagious is it?
So the answer for that is we do not know for sure, but our current working diagnosis is that this is likely a post-infectious complication of COVID-19, in that we saw this disease, a few months after COVID started popping up in the United States. And these patients obviously often do not have positive tests in their nose for the actual virus, but have positive antibody tests, which suggests to us that this is likely not infectious so much as this is a post-infectious complication.
Thank you.
D. Will.
Hello?
Yeah, we can hear you.
Okay.
You can turn your video on if you like.
I'm trying. It's saying the host has stopped it. I'm trying.
Sorry. Does that work? There you are.
Yes, thank you. Thank you. Just a couple quick questions. How long does the sickness last with these kids? And then is there a certain age that you're seeing this, or babies more susceptible? What's the age range of the kids that we're seeing with this?
So how long it lasts really depends on how quickly they recover from a clinical course. Some are more severe and require longer hospitalizations, and some will get better on their own over the course of perhaps a week or two. In terms of age range, this is one of the areas where it's slightly different than Kawasaki disease. Kawasaki disease is typically seen in children under the age of 5 and gets progressively more rare as you get older. With MISC, it seems like, well, certainly children under the age of 5 are affected. Older teenagers have also been diagnosed with this disease at a rate that's certainly higher than Kawasaki disease.
Thank you.
Can I ask a question?
Yes, who's speaking?
This is Katie Crowther. It's not letting me start the video. Oh, here we go. There you go. Hi.
Hi.
Just wondering, can you tell us where these patients are? They from all over the state? Were most of them from Milwaukee County? Do you have any indication as to where their families or where they're from?
I could start, and then Dr. Zhu could finish up. Since Children's Wisconsin serves the entire state of Wisconsin, the patients could originate from all over, but the majority of cases right now seem to be coming out of the southeast Wisconsin area. And I'd ask Dr. Zhu for confirmation about that too.
Right. I mean, that's also sort of where we're seeing higher rates of sort of COVID infection in children that are positive on our tests. So they could likely be related, but it's very early to see, and we haven't reported very many cases, so we can't say this for certain.
Thank you.
Ricardo Torres, I see your hand is up.
Yes, thank you. I was wondering if the doctors could expand more on the treatment for a child that's diagnosed with this.
Right. So the best treatment for this is still under investigation. Classically, what has been done for these patients initially is to treat them very similar to Kawasaki disease for the ones that are significantly ill and hospitalized, and that would be giving IVIG, which is an IV immunoglobulin that helps reduce inflammation. They sometimes will also give aspirin like in Kawasaki disease because this can help prevent sort of thrombosis or strokes and other clotting factors that can be seen in Kawasaki disease. Other things that have been being looked at are sort of other anti-inflammatory or immunomodulator agents that can sort of decrease the inflammation and immune response, such as steroids, things that inhibit other parts of the inflammatory system, such as infliximab, which is a TNF alpha inhibitor, and anakinra, which is an interleukin inhibitor, and tocilizumab, which is also a different interleukin inhibitor. But these are all sort of under investigation, and we are not certain yet at this time what is the best course of treatment for them.
Kent, I saw your hand up again. Kent, do you have another question?
Yeah, I'm here. I'm having difficulty with the video.
We'll get you next, Perry. Sorry, Perry.
Just real quickly, I want to ask about the sort of urgent response. How urgent is it that parents contact a physician as soon as they see this? And does this become more serious if it's not treated quickly?
Most likely, yes. So how urgent it is a difficult question to know exactly for sure, because it really depends on how ill the child appears, and what their clinical course will be. But our experience in discussing this with our sort of collaborators overseas and in hotspots such as New York and Detroit really have stated that once they're hospitalized, some of the children can get ill quite quickly. So what I would say for that is that if you have a suspicion or a concern, or your child looks decently ill, to contact your physician as quickly as possible. In terms of treatment, we don't know if early treatment, if delaying treatment will have huge consequences for them at this time. But for Kawasaki disease, the concern is that if you do not get treated early enough, you may develop heart problems later on with the dilation of some of the blood vessels around your heart. And since this is similar to Kawasaki disease in presentation, that is a concern that we do have. So we would say that we would want to treat them as early as possible, although nothing is set in stone yet.
Okay, thank you.
And all I would add is that parents know their children best, and if they feel that their children are ill, they should seek medical care. We want everyone to know that medical care is available at Children's of Wisconsin, and also that the ability to access that care is very, very important. We want people to know that the services that are provided are here and ready to serve, and they should seek medical care and not delay.
Real quickly, just so everyone knows, at the bottom of the, if you have a question, please raise your hand. There's click participants at the bottom of the screen. And on the right-hand side of the screen, there'll be a button that says raise hand, and I'll call on you. Perry Cruz, you're raising your hand?
Yeah, sorry. I was one of the people that maybe misunderstood that I needed to raise my hand over the
It's
video.
okay.
I just had a quick question. I was wondering, Dr. Zhu mentioned that this MIS-C syndrome is kind of the body's secondary response to the initial COVID-19 infection. Can you, I was hoping he could maybe expand on that and maybe give us an explanation as to how exactly that works in children's bodies.
Right. So certain after you get infected with viruses or other diseases, there are sometimes what we call post-infectious complications of this, which is really the body has successfully cleared the virus or infection from your body, but the sort of immune response is still kind of active and can go a little bit off kilter and affect different parts of the body. And really, this is actually the theory of what causes Kawasaki disease in children. One of the theories, anyway, which we're sort of applying this to COVID-19 and MIS-C because it does not seem like these children have active virus all the time that can be detected, but they always have active antibodies, which usually develop after an infection. With after 2 weeks or so, it's usually detectable. So we think that it's something to do with the body's sort of immune response still remaining active or reactivating after the infection that causes these symptoms.
Sorry, I am muted. Courtney Davis, you want to ask your question?
Yep, trying to get on here.
There you are.
There I am.
We see you.
Hello. I was wondering, I don't think you can probably see that from the limited cases in the state, but are you able to determine from the cases that have happened overseas and in other parts of the US, any kind of ethnicity, racial breakdown for the children that are presenting with this?
Yeah, I mean, it is early, so we cannot say with a 100% certainty, but certainly the first cases were sort of reported in Europe and in London in particular, and also the cases in the United States. It seems to be affecting African Americans or people of African descent a little bit more in these areas. And it does not seem to affect a similar percentage of sort of Caucasians as much as we would expect in terms of proportion to the population, although again, the numbers are not that large to say for sure. So we would say that similar to how COVID-19 seems to be more severe in the African American population in the United States, this may affect African Americans a little bit more. And interestingly, at least with our partners with Kawasaki disease in Japan and in China and things like that, this has not really been reported in any of the sort of Asian countries to any similar extent that it is seen in Europe and in the West. So it may be that Asians are less genetically susceptible, although there have been a few cases of Asian children with it in the United States and Europe. It's not a large percentage of the total cases.
Thank you.
I am not seeing any other hands raised. Any other questions people have for Dr. Zhu and Dr. Gutzeit? Again, click participants at the bottom of the screen, and on the right hand, there'll be a button that says raise hand if you have a question. Kent, you have another one?
Sure, Sarah. Yeah, thanks for continuing to come back to me. Just real quickly, just to confirm, there is no specific test for this, and it can present in children who may not have had any COVID symptoms. Is that correct?
Correct. So there is no specific test for it. It is a clinical diagnosis based on presentation and laboratory findings and excluding other infectious causes. The criteria with COVID is that they require either a positive COVID test, such as a PCR from the nose or a antibody test or a known exposure with COVID within the last 4 weeks. But as we are seeing more commonly, especially in children, COVID may not present with significant symptoms, and you may just be a carrier of the virus and be asymptomatic. So technically, you do not have to be ill with COVID, but you do need to have some association with it.
Okay, thank you.
I might take this opportunity to reinforce that in pediatrics, we often feel that the best treatment is prevention. So reminding everybody about hand hygiene, physical social distancing, and when appropriate, masking, as Dr. Zhu and I are doing, is always good advice and always a way to try to prevent the spread of COVID-19 in general.
I think that's a great message to end on. I'm not seeing any other questions. So again, thank you, Dr. Zhu, Dr. Gutzeit, for taking your time. Thank you, everyone, for coming out to our press conference. And that will be a wrap for today. Thank you all.
All right, thanks.
You're welcome. Thank you.
Yeah, thank you.